ensure a clean environment and avoid contaminated food and water. This is following an excess of severe gastroenteritis cases reported in Lagos in the last 48 to 72 hours. And, you know, the numbers we're dealing with are quite high. According to reports, we have 60 people hospitalized and 5 deaths so far. And to have this conversation with us here today is Olusegun Badejo. He's a state health educator and director of health promotion, Lagos State Ministry of Health. You're welcome, sir.
Thank you very much, presenter.
Now, what are we dealing with in terms of numbers? And this cholera outbreak, what is it about and how does it spread?
Thank you very much for this question. Cholera simply means a waterborne disease, and of course it affects both men, women, and children. And we have cases in Lagos. First, let's talk about the federal. In the federal, we have this outbreak in over 25 states in Nigeria, and we have over 815 people that have been admitted and 25 deaths recorded in Nigeria. So in Lagos State, also we have over 60 admission cases, and we have 5 recorded deaths in this following local government. We have Ojo, Lagos Island, Lagos Mainland, Mushin, Koshofe, Etiosa, and Ikorodu. So we have the public facilities in this local government are where the cases were reported, and of course some then have been treated, they've been discharged, but we have 5 deaths down now in the state, and it has not stopped there. So we are working with the state disease surveillance officers who give us daily report on the outbreak and the scourge in the state. So cholera is a very deadly disease, and it usually comes with a lot of watery stools and dehydration. So if a patient loses the body fluids for over 4 hours, is likely to die because it will suffer from dehydration. So when there is dehydration, the heart is badly affected, and it can stop the heart anytime.
Okay, what could be the reason these local governments you mentioned, why are they susceptible to this cholera outbreak?
Like the local government mentioned, it's not really, but if you look at some of these local governments, they are very close to slums area.
Okay.
So, and you have a lot of water dislodge around that particular area. But the issue is even that there are risk factors.
Okay.
Then we need to look at the risk factors. What are the risk factors? First and foremost, the causative organism of cholera is called Vibrio cholerae. It is a bacteria. And this bacteria, the host of this bacteria is the housefly. So anytime you put your food uncovered on the table, the fly is looking for something to feed on. And while feeding on, it also releases this bacteria on the food. And we take it through injection, and it's swallowed. And of course, if the individual does not have enough body immunity, then there will be a problem, because the bacteria will cause a lot of damages, inflammatory responses, and from there establish itself, and you see a lot of signs and symptoms progresses, and of course continue to show. So that's why it's a very dangerous disease. Now, how do we contact it? One, through contaminated food. So the food can be contaminated through this means, either at the point of production, or at the level of transportation, or at the level of storage or preparation. So when they are exposed to infections, the Vibrio cholerae, then they are contaminated. Then water too can be contaminated. So if we have water that are coming from unsafe of save point, or maybe the bottled water are not properly sealed. Of course, you are getting water from unsafe source. They can be contaminated. But don't forget that the flies too also need water to survive. So while they are taking, they also discharge the Vibrio cholerae there because it is in their fluid. So all these things are very key. We need to know. Then another one is that poor personal hygiene. Poor personal hygiene. Maybe you visit the toilet, you didn't wash your hands regularly, you touch dirty areas, you didn't wash your hands properly. All this because some of these bacteria are found in dirty places. So they are found in slums area. And good environmental sanitation is very, very key. So when you have a poor sanitation in a particular environment, and that's exactly why I mentioned the issue of people living in the slums area. Some of them don't have facility, toilet facility. So people defecate everywhere. And flies, there's an opportunity for flies to actually touch. And when it touches, the fly is not going to stay there. You also go and visit the homes that are that particular surrounding. And through that, they contaminate the food or water of the people that are around in that place. And once somebody picks it, then it is likely because of the signs and symptoms. A lot of, you see the person vomiting, you see the person passing out watery stool. There is what we call cramps all over the body, fever is there, and dehydration. And dehydration is a very important sign.
You mentioned it earlier that once you go into dehydration for about 4 hours.
Exactly. Yeah. So when somebody is dehydrated, so within 4 hours, and if something is not done, that person is likely to kick the bucket.
My colleague Abimbola has a question for you.
Okay.
So, Doctor, I'd like to ask, when you're dealing with children,
yes,
what are some of the precautionary measures that parents or caregivers need to take so that we don't expose these children to issues around cholera?
Okay, thank you very much. Like I mentioned the other time, the issue of precautionary measures is for both children and the adults. But looking at, or maybe I should just look at them together, so to save our time. So looking at the precautionary method, you know, it is the role of the parents to ensure that these children are saved. So number one, what kind of water are we giving to these children?
Okay.
It must be water that is hygienic, that is water from a safe source. So then when you suspect in a particular area, or you are suspecting, you are not sure of the source of water, what you need to do is that all water that must be given either to the children or to adults must be boiled.
Okay.
You boil the water. So while boiling, the process of heating destroys the bacteria and kills the bacteria that we may have in that particular water. So that's number one. Then number two is that children should not be allowed to defecate anyhow. So there should be a proper disposal of feces for them. Because don't forget, they are children. So you can even see them, after defecating, they can even start eating from that particular feces. So there must be a proper way. Like in our environment, we have pots. If we are not taking them to the toilet, and they defecate that even in the toilet, and you pour it out, and of course dispose it in a clean manner, such that it does not allow any means of contaminating either water or the food around. So that's very, very key. Then we mentioned of hygiene. Personal hygiene is very key. So the number one, we need to wash our hands regularly with soap and water, and that is very, very key. And any time that we visit the toilet, both when we visit the toilet, within and outside, we must do what? We must wash our hands with soap and water. So this is very sacrosanct. The other thing is that the environment where children are living is the same place that the adults are living. So we must ensure that there is a proper disposal of feces in our environment. Thank God that we have the toilet system now, so it makes it easier for everybody. But for those that live around slums, some of them don't have toilet facilities, and these are where we have issues. And we'll be educating people that they must ensure that they have toilet facilities in those area so that people can visit it. Even the people that are passing around, there are some designated points where you have public toilet facilities that anytime you are hooked up, you can quickly go there and, of course, defecate and, of course, make payment, clean yourself up, and you continue with your journey. So all food that must be eaten now must be properly cooked, well cooked. All fruits and vegetation must be well cleaned and well cooked now. So these are some of the things we are saying. Then we must ensure that our environment are very clean. We must ensure that all bushes are cut. Then we must ensure that disposal of refuse are not closer to our house. The Lagos has a recommendation of the prototype that you get a black nylon and you have a rope to tie. So when you have it, you put it in a container, and when you are pouring, when you are disposing the refuse there, you not just open it, you close it back. So when you close it back, you tie. So this will allow the fly to do what? To go there. And the fly, after investing there, will now leave the place, go and visit our people in our homes, and the next thing you see is that their food are contaminated, etc., etc.
Okay, I'm sure what applies to children also applies to
adults. Yes.
Adults.
Yes.
Now, are there any specific programs, you know, the State Ministry of Health is doing to ensure that, you know, people are more aware of this?
Yes, thank you very much. This is a very good question. But before I go into that, there's something that I must tell the publications. Yes, we could have an outbreak of cholera. Anybody can be contacted, anybody can be infected. But there's something that is key. This knowledge is very, very important. What is important is that we must know the difference between gastroenteritis and cholera. With cholera, there is stooling, watery stooling, and vomiting at the same time. The victim is personal feces, loose stool, and the same person is vomiting. So that makes it different from gastroenteritis. For gastroenteritis, you just see a watery stool, but may not necessarily accompany. But in this case, you are passing watery stool at the same time, spontaneously. The person is vomiting.
So which is more severe?
Cholera is more severe. The two of them are severe, but cholera is more because you lose more fluid. And when you lose more body fluids and electrolyte, there will be a point that the person will be dehydrated. When there is dehydration, then it means the body does not have enough body fluids to cope with body processes, and that's where the problem lies. The first organ of the body that will be affected is the heart. So the heart will go into a oligemic condition. That is, it doesn't have enough fluid and blood to send into general circulation. So when all the parts of the body, the vital organs are not getting fluids, then there will be a lot of problems. Because there are particular amount of blood and fluids that must be at a particular point, whether in the leg, in the head, in the eye, whether in the stomach, we call it body equilibrium. Yes, body fluid equilibrium. Okay. So the amount that is necessary for that particular organ to function must be there. So any depletion,
it's like feeling weak.
Yes, you're feeling weak. And when you feel weak, you are tired, you may not be able to see very well, and the next thing is you see the person collapsing.
Abimbola wants to add something quickly.
I just want to add here, because we do a lot of self-medication, where peculiar is that particular habits here in this part of the world. So at what point, once you start noticing some of these symptoms that you've mentioned, vomiting, watery stool, because sometimes it could just be a reaction and not necessarily you coming down with cholera. So at what point should you seek medical help?
Thank you very much. Anytime one has infection of that brings about losing of body fluids, because that is very, very key, vomiting, body weakness, we need to seek for prompt medical attention. Victim must be taken to the hospital. But along the line, there is a knowledge I want to pass here. When somebody is losing fluid, there's no magic a doctor is going to do in the hospital if he has lost the body fluid before he gets there.
So there should be some form of first aid before you move.
Yes, the patient is likely to have died before being transported to the hospital. So what's key is this, I want to say this, anybody that is losing fluid, whether through gastroenteritis, through diarrhea, or through cholera, what you need to do is that the public should quickly, anybody affected, the people around, all they needed to do is that just get just get like 2